popular topics that can cause a lot of confusion, so we're very excited to have our experts here today to answer some questions for y'all. I'd like to introduce our experts. We have Leslie Roan from My Medicare 65 and Kristen Martinelli, there we go, from Mir Senior Care Management and Care Consultants. So I'll start off with some Medicare questions for Leslie. What does Medicare cover?
Okay, well that's a big question. So Medicare is for people when they turn 65 or they have ESRD, end-stage renal disease, or Lou Gehrig's, or a disability, but mostly for people when they turn 65. Medicare is an interesting category. The key word in Medicare, according to the law, is that Medicare will cover anything that is medically necessary. That's your key word. If it's medically necessary, then Medicare will cover 80%, and 20% is your responsibility, which is where the insurance comes in. Medicare is made of 4 parts, A, B, C, and D. Let me keep going. Okay. So, Medicare can be confusing. It has penalties, deadlines, as you may know. Medicare Part A covers inpatient hospital care. So Part A, again, covers hospital care, skilled nursing facilities, surgery, lab tests done in the hospital, home health care, and hospice. It always surprises people to learn that Medicare does not cover some of the items that we all would expect it to cover, like dental care, eye exams for glasses, massage therapy, routine physical exams, hearing aids, that's a big one, and long-term care. Medicare does not cover these. I get these questions all the time. Part B. Part B provides outpatient care, doctor's appointments, preventative care, scans, tests. This includes services from doctors and other healthcare providers, outpatient care, home health care, durable medical equipment like wheelchairs, walkers, hospital beds, and other equipment. Your preventative screenings, shots, vaccines, and your yearly wellness visits are covered by Medicare. Some example of medically necessary services covered by Part B. Outpatient services like x-rays, stitches, cast, ambulance services, prescription drugs that you do not give yourself. So if you're having an infusion treatment, that's covered by Part B. If it's a prescription you're picking up at the drugstore, that's not Part B, that's Part D, as in dog. It also covers mental health services. The best thing to do when you have a question about medical services that Medicare covers, Google can be your best friend. But caution, when you Google, does Medicare cover? For example, last week, my brother, who is completely deaf, we just learned that hearing aids will no longer pick up his hearing, and he is needs the implants, the hearing implants. So the first thing I did was Google to see if Medicare covered it, and Medicare does cover it. Doesn't cover hearing aids. That's kind of an oxymoron, don't you think? So there's a lot of interesting questions when it comes to Medicare. Part D is Medicare drug coverage. That's offered through private companies. Sometimes it's, depending on your insurance, it is either included or you have to purchase it separately. And then last, I skipped C for a reason. Part C is Medicare Advantage plans. And Part C, since it's private insurance, does cover dental, vision, over-the-counter benefits, gym benefits, meals, transportation. It just depends on which kind of plan you have. So that pretty much covers A, B, C, and D with Medicare.
Thank you so much for covering the parts of Medicare. That was wonderful. One last question for you. Do I have to enroll in Medicare if I am still working?
That is another yes or no question. If you are still working and your company is 19 or less employees, then absolutely you want to enroll in Medicare. Because if you don't, then you won't have credible insurance and you'll get the penalty. Sometimes, if you're still working, you can sign up for Part A only, which will give you a secondary hospitalization insurance. But if your company insurance is a health savings account, don't sign up for Part A or you'll get a surprise excess tax of 6% come income tax time. Again, Medicare can be confusing. So always check with a Medicare advisor if you are still working so that you can cover these things before you do anything.
Thank you so much. It is so different person by person, so that's some great advice. All right, I have some Medicaid questions for Kristen now, if you're ready.
Ready?
What are the financial restrictions to qualifying for Medicaid?
Okay, so a lot of my answers are going to mirror Leslie's answers. There's a lot of confusion in Medicaid, as well as Medicare, and understanding what it covers, what it doesn't cover. Medicaid has several different programs. Inside those programs, they also have waiver programs, so kind of subsets of programs. The majority of the programs that we'll talk to, we'll only talk about the ones that make sense to our audience today, right? So we're going to talk about Medicaid for the elderly or people with disabilities. And then within that, there are some subsets. But for the most part, the income restriction is, for this year, $2,742 a month. The asset restriction is somewhere between $2,000 and $5,000, depending on what program you're trying to apply for. The income restrictions, those go up a little bit every year to allow for your increases in your Social Security income that you get. And then, but the asset levels, those pretty much stay the same. So that's going to be things that you have access to cash. So you're going to have your savings accounts, anything that you can turn into cash quick, that's going to count as an asset against you.
Thank you. Does Medicaid pay for private caregivers in the home?
So Medicaid can pay for private caregivers in the home. You do have to qualify for one of two programs. So there is a waiver program that allows for anywhere between 5 and 40 hours a week of caregivers in the home. However, you've got to meet those asset restrictions and then income restrictions, and there's a waiting period. So there's an interest list. You have to call a phone number and get yourself on the interest list. The interest list generally takes anywhere between 6 months and 18 months to 2 years to get your name to the top of the list or your loved one's name to the top of the list. And you have to qualify for Medicaid to be on that interest list. There is a separate program that actually also covers some in-home care, and a little plug for age, it also covers adult daycare programs. So that's another waiver program that you want to look into if you have a loved one staying with you, you're caregiving for, and you're working during the day and they would benefit from an adult daycare program. So there are a couple of different programs that Medicaid that do support personal caregivers in the home, but They require income and asset restrictions, they require medical necessity, and a lot of times there's a waiting list. So if your loved one falls, is in the hospital, goes through skilled nursing, is coming home, that person is not going to qualify because you don't have them on the particular program. So if they don't qualify when you need them, if that makes sense.
That does make sense. Thank you so much. What is the process to apply for Medicaid when my care recipient is ready for long-term care in a nursing home?
Okay, so in order to qualify for Medicaid in a long-term care facility, the first thing you need to do is find a facility that one has a Medicaid bed available and is accepting Medicaid pending. So you're gonna go into that facility, take a tour. My mom is gonna be Medicaid pending. Do you have any Medicaid pending beds available? What Medicaid pending means is that you need to move in. She meets medical necessity. She or he meets medical necessity, and they meet the financial restrictions. So again, the financial restrictions, the income is less than $2,742 a month. The assets are less than $2,000. If the income is over that, there are some ways to get around that with a Miller Trust, Qualified Income Trust. And there are some great estate planning attorneys out there that can help you kind of navigate that situation if that's a situation that you're in. But you can't actually apply for Medicaid until your loved one has been in the nursing home for 30 days. So they have to establish residency essentially in a nursing home. So for those 30 days, you're getting your documents together, you're filling out the application. On day 31, you're actually going to send in that Medicaid application to the state. The state has 45 days to respond to you. It's either a yes, no, or a maybe. Generally, it's a maybe. So they're gonna ask for more documentation, they're gonna want more bank statements. There's a 5-year look back for Medicaid now. So they're looking to see if there were assets or there was income, where has it been going? And then they have another 45 days to get you onto Medicaid. And during those 3 to 4 months, you're working directly with the nursing home to understand what the financial responsibility is for your loved one. And there's a negotiation there, and there's something called your applied income, which is what you'll pay the facility moving forward. And a lot of times you won't have to pay that money, that $4,000, $5,000, $6,000 up front, but you can pay your applied income, which is what the expectation is going to be whenever your loved one is on Medicaid.
Thank you.
You're welcome.
I think we're ready to take questions from our in-person audience as well as our virtual audience, and Blair's coming around with a microphone.
Hi. We've been through that process. My brother was in a nursing home. He came out through the community, there's a community program, and he does go to age. My question is, I asked you earlier, but I'm gonna ask you, I'm sorry, on the end.
Kristen,
My
yes.
question is, how do family members become paid caretakers? Because right now, as a caretaker to 2, I don't qualify. I signed up my boyfriend to be a caretaker, and my God, he helps us very, very, very much. But if something should happen to him, that leaves our household just in a horrible position. So are family members able to receive funds to be a paid caretaker when there's not another caretaker available? Because the pay is really low. And it's a huge problem. So I'm competing with McDonald's to hire people.
Mm-hmm.
You get paid $15 at McDonald's and $10, less than $10 before taxes to take care of your loved one. He is fully taken care of during the day at age, fully.
Right.
But it's 24-hour care that's needed at this point. What do families do?
So
Medicare is not helpful. I mean, it is helpful.
well, it's very
not
helpful in that situation.
But in Medicaid,
Right, it's not gonna
we
pay
have
anything
so
in that
much more
situation.
available to us now that we have Medicaid.
Mm-hmm.
But getting Medicaid was a horrible process.
Right.
It just was. He was in a nursing home and didn't need to be there.
Mm-hmm.
But that was the only way we could do it at that point. So it was drastic measures, and it's a big bummer to have to do that to the person that you love.
Yeah. Yeah, to get them on the waiver program that you're on, one of the ways to do that is to be in a nursing facility.
That's how we have to do it.
Right, and that generally will bump them to the top of the 2 or 3 year waiting list. They do have the option in those waiver programs to use consumer-directed care attendants, which is that what you're using right now with your boyfriend?
I mean, as much as I'm sure all the consumer care people are wonderful, we did not have that experience. We had people not showing up for work and saying that they did show up.
Mhm.
Now that's different because you have to do the EDD check-in thing and all that stuff. But I did not have any luck with having strangers in our home that were unreliable. And it's not that we worked with them, but it was not a solution for our family. Our family is to hire ourselves, which is what we've done, but good luck finding somebody that will do the nasty, dirty stuff that comes along with it.
Mhm.
So,
This is such a great question. So, Kristen, how do family caregivers become paid caregivers in the home?
Yeah, so there are 2 options when you get onto those waiver programs. And one of those options, like she was talking about, is to use an agency. It's very hard to find consistent staff. It's hard for those agencies to find staff that are going to work for the amount of money that Medicaid is paying them. And so a lot of our clients in the past have gone in that same direction, where you hire a family member, and it's not because the pay is good, but the family member is already there. The family member is already providing the service, so at least they're getting something, right, for that service. So that you have to be on those waiver programs to qualify for in-home caregivers. If you qualify for in-home caregivers, then you can choose your own caregiver, meaning it can be you or a loved one or a friend or a family member. But it's all part of the application process. You've got to apply to be on those waiver programs. And then you're only going to qualify for, they determine, right? Medicaid sends out, I don't want to call them a nurse, but Medicaid sends someone out to do the evaluation, and they actually are the ones that determine how much paid care you're going to get. So that's going to be 5 hours to 40 hours, but it's not going to be 24 hours.
I think my question more is that when we had just Medicare, it was a possibility to have someone living in the home that was a family member. Now that we have Medicaid, you can't be living in the home. That's where it gets confusing to me. You can't have someone that's living in the home that cannot legally live there. Unless you can point me in the right direction, that's the wall that I've hit with that, is that you cannot live in the same home. Do you know about that?
Are you saying because you would have an income, so it would change their...
No, from what I understand, you cannot live in the same home and be paid. You have to have an out-of-home caretaker.
Yeah, I am not familiar with that rule. I do have clients who live with their loved one, and the loved one is getting paid through the
And
waiver
they're on
program.
Medicaid? Because when
Correct.
we had Medicare, that was an option. But when we switched over to Medicaid, much better programs, but not able to work, not able to have someone living in the home.
Yeah, I don't know. Maybe we can talk separately after this and explore it more. Yeah.
Kristen, can you really quickly just say what the name of the waiver programs are called? The virtual audience is what he said.
Oh, yes, sure. So I have that information here. The CCSE stands for Community Care Services Eligibility. So that's an entitlement program. If you qualify for that program, there is not a wait list, okay? And that program covers adult daycare, meal delivery, emergency response services, and in-home care. And then the other program, the Star Plus Waiver Program, is the Home and Community-Based Services, what it used to be called. They provide help in the home with basic daily activities. There's an assigned number of hours per pay that you qualify for. They pay for modifications to the home, and they pay for short-term or respite care stays in a nursing facility. That you must already be enrolled in Medicaid for. You have to put yourself on the interest list, and the wait list is generally 6 months to 2 years. And it also provides health care coverage. It becomes your supplement to Medicare.
Are these federal or state
The question is, are these federal or state or both programs?
It's both.
If it takes you 2 years, up to 2 years on the waiting list, some people, they're gone by then. It's sort of like long-term health care insurance. There are so many things that you have, so many hoops you have to jump through that you're not able to meet those hoops. And people have paid for them for years and then are not even available, they're not available for them to use. So when do we get to the point where people who need them actually get the care they need from Medicare, Medicaid, and don't fall through the cracks because of time?
Yeah, I mean, I wish I could answer that question for you. I feel the exact same way, I can tell you that. It's a long, arduous process to get onto one of these Medicaid waiver programs. And to the last question, Medicare is a federally funded program. Medicaid varies state by state. So each state has their own individual rules and individual programs and waiver programs. But I hear you. It is a long and arduous process, and sometimes by the time someone comes to the top of that list, they aren't here anymore.
And we won't get into the political part of it
Yeah.
at all.
Ask away.
Go ahead, Rebecca.
So I have a question for the Medicare broker. If I'm about to turn 65 and I get all this mail from everybody in the world about different supplemental insurances, and I really think I'm a fairly educated, able to understand whatever, are there resources we can use that can help us go through the process of signing up for Medicare, not necessarily Medicare, but the supplemental insurance? Is there help out there so that someone can explain it to me and I don't have to rely on what Google tells me?
Yes. So, and yes, you will get a lot of mail. I've actually gone to meet clients that have had a grocery bag full of mail when you are turning 65. Medicare.gov has done a great job of explaining a lot of things. I mean, they have a fabulous website. You can just about put anything in the search column. You can go there, you can sign up, you can read about A only, or do you need part A and B? There's also a couple of websites, Medicare Interactive. You always want to make sure you go to a .org or a .gov site so that you don't get cookied and bombarded. But there is a lot of good information on that site regarding signing up for Medicare, regarding should I or should I wait. They've done a great job of explaining that. And, you know, if I wait, is there a penalty? Does that answer your question?
I want to know the supplemental part.
Okay, on the supplemental part, CMS, Center for Medicare Services, does put out a good guideline for signing up for supplemental, which is your Plan G's, F, N. They also call them the alphabet plan. That publication, which is updated every year, does a great job of explaining a supplement. As far as going online and signing up for one, it's best if you work with an insurance agent or a broker, because on a supplement, they can charge, they all are covered the same way. In other words, they're all red delicious apples. They all have to cover the same way by law. But they can charge whatever they want for that red delicious apple. Just like if you go to 7-Eleven to buy a jar of Hellmann's mayonnaise, or if you go to Costco or Target, you're going to pay 3 different prices. The same thing with a supplement plan. They can charge. Okay, they can charge whatever they want for that supplement plan. So you want to make sure that you do your homework.
You're a broker. Are you a person that someone could go to help figure out the supplement?
Yeah.
I think that.
And that's what I do. Can y'all hear me?
Okay.
How do you find people like you? Repeat the question for the people online. How do you find people like?
Supplemental insurance and how to sign up for Medicare supplements. And unfortunately, this is a very big topic and we are out of time. So I'm so sorry about that. This was our great mini session, lots of great questions. Thank you all so much. We'll come back in about 5 minutes, or do you want to announce something next?
What's happening next is our engagement activities. So that is if you signed up for the estate planning session, the yoga activity, or the 1 word, 1 year activity. If you signed up for the estate planning session, you're going to be in the conference room connected to the lobby. If you signed up for the yoga activity, you're in ballroom B. So if you go out this door and turn to your right, it's the first door on your right. And if you're doing the 1 word activity,